All right, we are live, and today we're talking about complex regional pain syndrome. November is the month for awareness of CRPS, and so we have a brand new resource, and we're sharing it with you all. And I get to talk to Michael Chung, our CRPS program director today, so I'm so excited about that. If you have not, if we haven't met, my name is Julie Hirschberg. I'm a neurologic physical therapist and the owner and founder of Re+active, and I get to work with a pretty incredible team. Michael is one CRPS. We're going to talk about our program. We're going to answer your questions. I want to say hello to a few people. I see Beth here, and I just want to say hello. I got your letter today, Beth. Hi, Michael. I was just saying hello to people in the chat. I saw Beth here. She sent us a letter, and I got it today. And I just love our people so much. So welcome, Michael.
Oh, how you doing?
I'm doing pretty good. And Beth says hello. So um we've got lots of folks joining us tonight. Maybe everybody needed a break from politics and wanted to talk about CRPS. I know I needed a break. So I'm glad. Thank you for so many people joining us. And I was sharing, Michael, how I get to work with great people like you, but people might not have met you. So I also wonder if you could just share a little bit about yourself as a
All
physical
right,
therapist.
all right, yeah. Hi, everyone. Well, I'm happy to be here today. I guess just a little bit about me outside of all the physical therapy stuff, just to get to know me. I'm like I have the world's brownest thumb. As much as I love my monstera, that is like struggling, and like holding its life by like just one stem now. I have such a big brown thumb. I love surfing and I love my dog. And I let's see, my journey with CRPS and my journey as a physical therapist with CRPS really started with my clinical rotations in orthopedics. And many of these clients would come to the clinic sharing how they have pain wherever it might be, their foot, their shoulder, their hand. And a lot of the times, as an early clinician, I was responding to not in their language. They were sharing about their pain, and my response was, "Let's strengthen it. Let's stretch it. Let's mobilize it." And I thought there had to be more. And so I would look into like the pain research, and I kind of stumbled upon complex regional pain syndrome. And I was like, "Oh yeah, it's complex. It's regional. It affects one area of the body usually. It's painful for sure, and it's a syndrome, and there's multiple things to kind of tackle on." And that's my journey, and I'm happy to be helping out the CRPS program here at Reactive.
And leading it, leading the charge. And, it might be helpful for folks that are joining us that might not know exactly what CRPS is. I wonder if you could give, I know it's complex, but like a brief description of it too, if people haven't heard of it.
Yeah, CRPS is exactly how it sounds, but a little bit more. So it's more than just having a very complex, painful problem. It's a true and real diagnosis. Walking through the history, some people might call it reflexive sympathetic disorder or dystrophy. That was kind of changed because it was more than just the sympathetic autonomic dysfunction. It's really the syndrome and classification of the sensory system, the motor system, the pain neurotag, all coming together to create um, like very, very real and very, very painful pain, right? And it's typically characterized with color changes and swelling, and yeah, pain is the biggest thing.
Yeah, painful pain. I'm going to start using that now. But it is one of the most painful pain disorders, and that is a big component of why we have this program, right, is because it's very disabling for people, right? And so we started our CRPS program a while back with one of your mentors and my colleague and mentor, Brittany Kim, when she started with us. And it has definitely grown and evolved as we've had integrated care. I wonder if you can talk a little bit about what makes our CRPS program unique.
Yeah, that is, if I had to summarize it in three big points, right?
Mhm.
The number one point is that you get an integrated team. It's not just physical therapy, and a lot of times people ask me like, what else is it? And we have physical therapy, occupational therapy, psychology, and yoga therapy, and it's not as dichotomized as, this is what physical therapist does, this is what occupational therapy does. We all come together to meet you where you're at, and we all, with our specific lens, try to help get you to your goals.
Mhm.
Um, that's like the best, simplest, nice packaged way of explaining our model.
Yeah,
Uh,
yeah,
and the
that's
second
great.
point is that our therapists all work together and we're all in one roof and we coordinate with your pain management team, with your surgeons, and all of that. And our third point is that we have a lot of co-treats. And within these co-treats, we learn so much that we end up teaching other clinicians on how to lead co-treats, how to treat people with CRPS, what is the things to do, and what are the things not to do.
Yeah, yeah, I live for a good co-treat. And if people don't know what that is, I know our clinicians will, but if you're a person with a disorder, maybe you hadn't heard the term and maybe you've never experienced that, but that is where maybe the PT or OT actually work in a session together with a psychologist, or PT and OT together. So two brains to one problem. And it is more than twice as effective, I would say. It usually opens windows and doors to things that we had never thought of. It's probably my favorite thing to be a part of, for sure. Now, Michael, one of the questions that I get from folks is a lot of folks are like, oh, CRPS, pain syndrome, I need physical therapy. But understanding the rest of the team and why that might be important. Now, you and I are both physical therapists, but I think you and I are both really big fans of the other parts of the team. And I wonder if you can share a little bit about what the other aspects, why those are so integral in CRPS.
Totally. Yeah. Well, we know pain itself is much like this fidget toy that I'm using. It's not just one bubble, it's all of the bubbles, right? And with the pain neurotech, it's implementing the sensory cortex, the visual cortex, the default mode network, and that's why we have this team. The easiest way I can maybe break it down is and it's not as dichotomized as this, but our occupational therapists, I see them have like almost two routes of when it comes to treatment. One is that lifestyle intervention. That might mean cognitive behavioral therapy within the context of insomnia and sleep disorders, energy management, and mindfulness. And then the second route that they sometimes take is opening up new chapters, and that's really big in our clients with CRPS, meaning like return to work, moving out of their mom's house, and return to their like favorite activities. That's what our occupational therapists are really known for, and our psychologists help with kind of the emotional and cognitive brain health with the mind-body practices. Um, to contrast that with PT a little bit, I think people understand PT as this bottom up regulation that I'm going to move to help my pain.
Mm.
And our psychologists are the opposite direction. It's like, how can we change our thoughts to change our pain?
Yeah, yeah, that's great. And when we bring them all together, I feel like that is magical. And like you said, I think you described each of them so nicely, but it's like we come together to figure out what that person needs to get back to life. And I think that is one of the coolest outcomes to see in our CRPS program is people getting back to life. And I wonder if you can share a little bit about what kinds of things, like outcomes, people might get in doing a program with us.
Yeah, we track a couple of different outcome measures as to, um, what our outcomes look like. They really all boil down to like quality of life or getting back into the activities that you want to get back into. When I did our analysis of all our folks, both in person and virtual, out of a seven, one through seven, seven meaning you made the best change that you made, 85% of our clients have chosen six or seven,
Mm,
right? A better and definite improvement to like a great deal better. And that's just one measure that we use. And then everybody else gets their personalized outcome measures. I want to go back into dancing. I want to get it back into hiking. And what does that look like? And how do you feel about it now? And how do you feel about it at the end of the program? A lot of the times, the end of the program also not is a time benchmark, but also a time for us to do mini field trips, right? And so
yeah.
our clients have finished 5Ks after their program, have done hiking, returned to dancing, and it's just a whole bunch of fun.
Yeah, I was going to say one of my, I wasn't there, but I heard about it. And I got to meet this client who got back to running. And you and Malia, our OT, did a 5K with her, for which she was much more experienced than you. I understand.
Right.
Um,
Sure.
but that's a huge accomplishment for anybody that has experienced CRPS in their limbs. To be able to run again is really awesome.
Especially for a runner.
Especially, I'm speaking as a runner. Like, yes, that would be the like real getting back to life, getting back to some of the things that bring a person joy, and really honing in on all of the pieces of the pie, the sensory, the autonomic, the lifestyle, the motor control, the physical impairments, and so on. Um, and I also didn't realize that 85% of our folks were a 6 or 7, because that also is very high. We should publish that, Michael. That's really good. One of the questions that I get a lot from clinicians and from people with CRPS or even other disorders is about graded motor imagery. I think people generally like have seen a mirror therapy or different pieces of that, and I know you created a resource for this specifically for people, but I wonder if you could talk through a little bit about how you might use that in a case.
Yeah, of course. I created this freebie, this graded motor imagery fast track, as you will, because of my testimony. That was I was looking into pain research, right? And so one example of this, and I'll try to pull in all of the people that was a part of this, because it wasn't just the physical
Mhm.
therapist that did this. This person had come in for a 4-week intensive, and they started off non-weight bearing, so meaning they couldn't put weight on their feet, and their biggest goal was to return to hiking. Going downstairs was the biggest issue, just because how the foot moved for them. And we just started with, can you identify left versus right? And that progressed into, can you imagine the movement? And then we started weight bearing with the other side within a mirror. And slowly that progressed into this person putting their foot down without them even realizing that they started weight bearing on their foot. We kind of almost rinsed and repeated it just a little bit, into the context of standing, into the context of going down these steps. And after the 4 week intensive, they were walking all over town. We walked them right, or they walked me outside of the building to show me how they would get down the stairs. And yeah, it was just a really, really big moment. And I thought that, you know, as I do these consultations for people with CRPS and ask, you know, what are you doing in therapy? I find that this is the missing link for a lot of
Mm.
folks, something that might help people get into the next stage.
Awesome. And I'm sorry, my lights are going in and out. Like, I feel like I am at a rave. My lights are going in and out the whole time that you're talking, and that's so distracting. I'm so sorry. But I've seen videos of this patient that you have shared. And I think I agree that almost this group, PTOT, psychology, yoga therapy, graded motor imagery, as a part. And I would say, like, it's not a protocol, right? It's not a cookbook. It's very individualized, specific to what that person is looking to get back to. And it works. It really works. There's a method to the madness, because there's also a lot of creativity. This is something that maybe, I don't know if you'll toot your own horn, Michael, but I will toot your horn, is when I'm in the clinic with Michael and you're often working with a person who's experiencing pain in some way, the creative aspect of how you set up the environment, the sensory experience, the autonomic, how that person is moving, the fun that goes, like, you've joined in on many a TikTok dance, and I don't know that that is your natural pastime to do TikTok dances, but you will put yourself out there to do the 5K, to do the thing, and get very, very creative with it. And that's something I'd say with a lot of our therapists, but I think you are truly a master of that. And I think it goes a long way when someone's in severe pain.
Yeah, yeah. I mean, like that brings up like someone I just worked with this week who their goal was to, you know, get back into cooking, and they have bilateral CRPS. So both, um, and, and we just started working on, you know, like you said, it's not a cookbook, and this person, the mirror probably wouldn't work because it's both hands, right? So would watch me like play with a ball, or like watch me and like cut the ball in half, right? And they would do it with me. And the next step was we went to Trader Joe's and got a couple of salad items, and they made salad and cut the pear with Malia, our OT. That was such a sweet, sweet moment for that person.
That is, so did you walk down to Trader Joe's down the street
Yeah, they're
and get that?
also to push the shopping cart. So we made it happen. Like it's much easier to go to the shop, you know, go to the grocery store than try to create a grocery store.
That is so true. We happen to have a Trader Joe's that is a nice little walk away. So, that, yeah, bilateral. And I've had folks ask me, I mean, we've had folks with almost like full body CRPS symptoms, bilateral symptoms, and people have asked, well, what do you do? Because some of the things that you might look at, like with mirror therapy and graded motor imagery, really rely on using the other limb, and that's where you get creative. Right? So you did some imagery, and I know we do this a lot with either videos where it's an action observation or it's watching something with both hands. You use that in lieu of doing like a video or a mirror type activity. Is that right? Yeah.
You can, you know, we can pre-record these videos. We've done someone wants to work on typing, we'll have like a gif of someone's like fingers typing, and they're you know working on their computer while this is running on the side.
Yeah, I love that. Those are great ideas for all of our clinicians joining us. Now, you mentioned something, and it made me think of a question, which was, how long are people typically in a program? Because you mentioned the one woman getting back to walking on the stairs, that was a 4 week program, I think,
Yeah,
right?
yeah. That's true. Everybody's different. And so I guess might be helpful to walk through the processes before we kind of expand that. So if you go on reactivept.com, like top right corner, there's apply now. And if you have CRPS, you'd apply for the CRPS program. We have a lot of programs here at Reactive. And you fill out all your information and you have a consultation with me where we'll discuss, what are the goals and what is needed to get there. There's a lot of factors that go into, how long a program goes for, but typically on average, they're about 8 weeks long. But a lot of people kind of opt for a little bit more. Some people, can only come into town for a couple of weeks. And so we try to personalize it as best as we can. Because one thing that I can tell you doesn't work for CRPS is a cookie cutter approach. And that doesn't work so well in terms of like a research standpoint, right? Where everybody gets like the same treatment, but it works well for a like person who's looking to get better. So we try to individualize everything.
Mm-hmm. Yeah. And what do those like typical frequency look like over that course of 2 weeks or 4 weeks or what have you?
Yeah, typically um, people have the whole team: physical therapy, occupational therapy, psychology, and yoga therapy for at least like 2 or 3 sessions each per week. So typically people know what physical therapy is. That's a lot more comfortable. They're more open to doing 3 times a week or 4 times a week, even 3 times or 2 times a week for occupational therapy and 2 times a week for psychology. And one of those sessions will be with the physical therapist, tackling on some of the bigger barriers to their movement and fears of moving and all of that.
Yeah, yeah, that's great. And I think bottom line is it's individualized. Like what does that person need? And what are their goals, right? I know we've had surgeons wanting to get back to surgery and really fine intricate tasks, and that that's a specific goal. Getting back to running is a particular goal, right? So very specific. And I think one of one of the things that I think about, especially for CRPS month and spreading awareness, is that people can get better. And I know because we've worked with a lot of people who maybe had CRPS for many years, 10 years, 12 years, right? And I, yeah, I wonder if you can speak to that a little bit because you meet folks for that first consultation. And I think that's what I've heard a lot is like, I'm not sure that this can get
Right,
better.
right. I hear that a lot too. And um, the opposite is true is that people do get better. And I mean, we can talk, you and I can probably talk for hours about neuroplasticity. We can talk a lot about recovery stories, but I guess the simplest way I've noticed that people understand and people really react really well to is that CRPS, boiled down to one sentence, is that like the brain got really good at pain, right? And that doesn't mean that it can't unlearn pain, right? That's the nice thing about learning is that you can unlearn something, or you can learn other ways to manage the pain or to fully recover from the pain. And so that's what I share with my clients. And um, you know, unfortunately, there is that there are folks who do experience a lot of pain and this long-standing pain.
Mhm.
What I share with them is, you know, choose your measuring stick wisely, right? And our pain can fluctuate, like if we sleep poorly or if we drink a little alcohol the night before. That doesn't necessarily mean that you're getting worse, right? But if you're tracking, for example, one individual we're working with right now is returning to skiing, and um, that's their measuring stick. That's their sole measure:
Mhm.
is, am I able to ski this Thanksgiving, right? And that's, yeah, that's my 2 cents.
Yeah. I think they're going to be able to ski. And I don't know that we will have any snow on Thanksgiving, but that's a separate story. I've seen the coolest thing that some of our team has done in somebody returning to skiing was like cold air blowing on them, simulated skiing. It looked so fun. Um, to get back to that fun, which was skiing.
Yeah,
So I'm excited for that person to get back. Um, you mentioned it. If people are interested, so whether you're a clinician that is looking for a place of really whole person approach to CRPS, or if you're a person with CRPS looking for more, and you want to meet with Michael because he'll do the consultation and really answer all of your questions. The website, Michael, is reactivept.com/CRPS to get right to the program, right?
right, right.
Yeah. Um, so, Michael, thank you for sharing about our program and your passion for CRPS, and more importantly, I think your passion for people and really helping them reach those goals and milestones, and be living again.
Totally. Yeah. And shooting for pain recovery instead of pain management.
Yeah, yeah. I love that you can recover. And so very good, Michael. I'm so thankful to have you leading this program and on our team, and also thankful for you joining in this live with me too.
Big fan. Thank you, everyone.
All right. Take care, Michael.
Thank you.
Bye.